on the one hand, obviously public health, more so than during a global pandemic, is top of mind. How much can we depoliticize it? How important is it, from your point of view, that it not become a football in a political process?
Well, that's just the moment. I think public health, we're having that out of Snoopy, where Lucy's holding the ball and keeps moving it. That's what we've been doing, actually, to public health. It can't be a political issue, but it also can't be a neglected issue, which is in many ways been happening for years and years before the pandemic even hit. And that's why we really need to make a commitment to rebuild it. This is an infrastructure issue, regardless of who wins the election.
Shelley, we've heard from both candidates that they have plans and so on to, deal with coronavirus post the election. I mean, whether they do or don't, it's almost beside the point at this point, because the system is just not working. I mean, obviously it's out of control, but it's also out of control in the UK, where there is free public health care for everybody. So what lessons can you really take away from this in order to make the argument for more funded public health?
Well, there are a few elements that you have to peel back. One is on the emergency response. We are in the midst of a global pandemic. It is going to have wave after wave, and that's the challenge in emergency response. This isn't just a sprinting event. This is a marathon with lots of little sprints involved. And so what's happening in the UK and other parts of the EU, it's likely to happen here as we continue to have surges taking place that we'll have to consider everything from lockdowns, targeted lockdowns, to the issue of mask wearing. This is going to be with us for a while, and we have to learn on how to do those immediate measures in addition to getting better and better down the road for whatever else comes at us, which will happen.
Just give us a sense of where you think, we know infrastructure spending may be something that comes, there's a blue wave. Where in that spending on infrastructure would you put public health?
Well, this is really, again, a critical element of whether you have a new administration or the current administration stays in place. There has got to be further investments in strengthening that public health system, not just for COVID, but actually what's costing our economy the greatest over time, which is our high rates of chronic diseases. And if we rebuild it properly, it is actually going to make us better prepared for the next public health emergency, in addition to really reducing, again, our chronic problems of cancer, of asthma, of heart disease. It's costing our economy right now as the sickest nation in the world, and those kinds of smart fixes can put us to be better prepared for living longer, healthier lives.
Shelley, have you ever figured out why people are reluctant to have other people, if you like, to put it in very layman's terms, other people pay for their health care, even when it's clearly in their interest to do so, and it's a widely accepted way of doing things in other countries?
Well, here's the thing. What we were actually talking about are some of the fixes and protections that are before you even get into the hospital or healthcare business. When we talk public health, it's really about keeping people out of the being sick business. So there's a great report that just came out 2 weeks ago by McKinsey that actually took a look at the fact that the U.S. economy is really getting slammed in the ballpark of $3.2 trillion because of premature deaths and lost productivity. And the fixes that they were seeing, where you could cut the disease burden significantly by a third, it's not health care. It's actually things that we already know to do, such as reducing smoking rates, addressing mental health, the lack of parity there, some of the basic fixes, even with our transportation system. So it's not healthcare. It's actually about how do we keep us all healthy and well and out of the hospital.